Hello and welcome to Dialogue. I'm Xu Qinduo. China has mapped out a series of measures aimed at enabling grassroots medical facilities to promptly identify and offer treatment to patients at the risk of becoming severe cases. According to a press briefing, special attention will be paid to those at the age of 65 and above, as well as those with pre-existing conditions. So after 3 years of dynamic zero policy, how is China's medical system dealing with the current COVID wave? What are people most concerned about in the country? To continue our discussions on the situation since China lifted COVID restrictions, I'm glad to be joined by Dr. Alice Hyun-Kyung TAN, internist at MizMedi Women's Hospital in South Korea, Professor Wu Zhiwei, Director of the Center for Public Health Research at the Medical School of Nanjing University. We'll start with the measures taken by Sichuan Province to help senior residents get vaccinated against COVID-19, reported by my colleague Zheng Songwu in Sichuan Province.
Senior residents are usually worried about getting vaccinated. Some of them have underlying conditions and are concerned about the possible side effects. But now more senior residents in Chengdu are getting vaccinated because they have been assured of the safety of vaccines, and the local authority has taken measures to facilitate the vaccination process.
COVID-19 vaccines can protect the seniors well, especially those who are over 80 years old. There are several ways to help them get vaccinated easily, and now I am at one of the temporary vaccination sites in Chengdu, and the medical staff here have set up special areas for seniors and offer them the best service possible.
The number of seniors coming to be vaccinated during weekends is much more than weekdays because their family members can take them to get the shot. The medical staff also help them with the process.
All residents can call on medical staff for counseling or help 24 hours a day. We've set up special areas in the vaccination rooms for seniors. There are also medical workers to help seniors who are disabled or live by themselves to get vaccinated at their door.
An increasing number of seniors with underlying conditions like hypertension are getting vaccinated.
This is my grandma, and she just got her first dose today. She is almost 80 years old, and we were afraid she would get COVID if somebody in our family was infected. Her blood pressure was a bit high, so the medical staff led us to a seat first and then guided us all the way to finish the vaccination.
This is my husband, and he will be 84 years old soon. This is his third dose. The special area for seniors was efficient, and the medical staff asked if we had any underlying conditions. They were very gentle to us.
Chengdu is encouraging more seniors to get vaccinated and trying to facilitate the process by setting up temporary vaccination vehicles and asking physicians to ensure seniors about the safety of vaccines.
Now we have Songwu with us. Hello, Songwu. You reported about the situation in Chengdu, the capital city of Sichuan Province. I mean, there is one of the largest populations in the country. So tell us more about the vaccination, the overall vaccination progress in Sichuan Province, in particular with this vulnerable group such as the seniors and those with existing conditions.
Well, senior residents are still the main groups who needed to be vaccinated in Sichuan Province, but some of them believe they are not likely to be infected because they only stay at home. But as the Spring Festival comes, the local government has been encouraging more of them to be vaccinated. Apart from hospitals and temporary vaccination sites in communities or nursing centers, there are also some temporary vaccination vehicles in parks or streets for older residents, including senior residents. And in some communities, physicians are important in encouraging the seniors to be vaccinated. In many of the communities in Sichuan Province, physicians will do physical examinations for the elder groups at the end of the year, and they will also seize the opportunity to encourage them to be vaccinated because they are more familiar with each other. And in rural areas, the hospitals also tell the elder groups the necessity of the vaccination by using broadcasts or loudspeakers because many of the senior residents don't use cell phones very well. And the Health Commission of the Sichuan Province has also invited local celebrities to encourage the seniors to be vaccinated. Back to you.
Songwu, so as we said, Chengdu is a large province with a large population. How about the COVID infection there? We know that like in Beijing, Guangzhou or Shanghai, say the peak already gone, and so we are seeing the recovery or slow recovery. People are getting back to normal. What about Sichuan?
Yeah, 80% of the people in Sichuan Province have already been infected, but many of them have recovered. And the peak of the current wave of the COVID-19 is over, but people's needs for medical care are still big, especially those senior COVID patients with basic ailments who are easy to be a critical condition. And Western China Hospital is one of the top hospitals in China and is very important in southwestern China. We visited its 10th hospital a few days ago, and the pressure on the emergency department was still big, but the hospital rearranged all its departments to help a patient. For example, they sent medical workers to departments with shortages, and the professors in respiratory department wrote medical instructions for surgical departments so they could take good care of the COVID patients. And all the patients received all the departments received the patients from the emergency department to relieve its pressure. And the intensive care unit has also expanded its sick beds from 20 to 60 and also prepared 80 ventilators and nearly 200 medical workers for the patients who are in critical condition. And also the China's National Health Commission has also organized the top medical experts to offer guidance for ICU departments in many provinces, and the experts in Sichuan Province have offered guidance for ICU in Sichuan Province in more than 10 hospitals in Sichuan Province since Monday, and today we just followed them to Yibin in southeast Sichuan Province, and the experts in Sichuan Province told us that the hospitals they visited did well in taking care of the patients in critical condition, but there is still room for improvement. And all the staff, medical staff should be well prepared because the peak of the critical condition in Sichuan Province is yet to come. Back to you.
Well, thank you, Songwu. Thank you for the coverage. We have now the distinguished guest with us, and to take a closer look at the Chinese response to the disease, obviously. Zhiwei from Nanjing, Professor Wu from Nanjing Hospital, Nanjing University. And now, as our reporter reported, Zhiwei, you see there's a shortage of medicine and shortage of hands and probably intensive care units. Obviously, the healthcare system of the country is under pressure. It has been under pressure for some time. So what is the priority right now, and what should we, what is the toughest challenge for the country?
Well, initially it was quite chaotic. You can see that because the opening up back to normal was basically announced quite sudden. So many of the hospitals and the general populations were just caught off guard. So what happened is that in the very early stage, the hospitals were very confused and basically trying to adapt to the new policy, because in the past 3 years, the hospitals' clinical procedure and admission requirement basically were designed to accommodate the Class B disease and the Class A management, which was much more stringent than the Class B and the Class B management. So it was just took quite a while to adjust. The second is that initially, the local pharmacies basically across whole countries were poorly prepared for the medicine supplies, and even thermometers and face masks, and you can just count all those relevant stuff actually just ran out so quickly. When the people are in the panic buy, the problem is that when they feel that they were infected, they simply they just flock into hospitals. So, like in my university, the affiliated hospitals, it was just so crowded that the people, they went into the emergency room, fever clinics, and full of people. So the clinicians and nurse, what they were trying to do is trying to persuade people and trying to send them back to their home, because basically most of them do not need to come into hospital. So that was the initial phase. But now seems to be that if you go into the hospital, the situation is much better. It's in a much orderly manner. And last week I went to northern part of China, and you can see that in the pharmacies you can buy fever medicines and all sorts of medicines for mucus clearance and thermometers. So basically, largely they are available. That's a very good sign. And in Nanjing, you can see that I think the peak infection probably already almost reached, because if you look at the streets and the banks and other public services, actually about a week or 10 days ago, many of the services were suspended because people are all sick. Now, basically, you can see that almost coming back to normal. People are coming into the streets. So I think it's a good sign in the big cities that we are basically taking the brunt of this new wave of infections. So I hope that once the infections happen in the rural or the less developed region counties, then this is a good lesson that for people to learn and do preparation in the early stage.
Preparation in early stage. Dr. Alice Tan, we know, as our reporter said, that in Sichuan, 80% of the population probably are already infected and they are recovering. And in big cities like Beijing, Shanghai, Guangzhou, for example, they were the first group of cities being hit by the new wave of infection. And actually, they are coming back. And the holiday, New Year holiday, for example, there's an increase of spending, increase of traveling. Still, for the overall situation, the country is still at the very beginning, probably, at dealing with this surge. What do you see are the priorities for the healthcare system, for the government to do?
First of all, it was very encouraging, I think, the report that was given at the beginning of the program in terms of what is being done. And I think a lot of things are being done correctly. So resource management is a priority, and you need to be able to assess in real time how many ICU beds are open in which hospitals. And if you keep track of the number of positive cases who are greater than 60 years old, you will be able to predict fairly accurately what sort of needs the healthcare system need to prepare for in terms of treating severe cases in ICUs. And so that's one of the reasons why it's so important to do testing and to have that data ready and available in real time, because that helps you predict where the resources will need to be shunted. there will be communities that are hit at different times. There are communities that have different levels of immunity because of differences in vaccination rates. You can use this data to predict who is going to need, which community is going to need help in terms of ICU care, in terms of ventilators, in terms of medications and manpower. Also, I think for communities that become overwhelmed, having transport services ready so that people who are critically ill, who cannot get the care that they need where they live, they can be transported to another regional center, perhaps either by ambulance or helicopter in some cases. And so resource management, I think, is the most important thing that can be done acutely. Of course, parallel to this is to continue with the vaccination campaign that's already, picking up speed, making sure that people are up to date on their boosters, letting people know that if 6 months have passed since your last infection or your last dose of a vaccine, your immunity has waned. And so that's why getting a booster is so important. And keeping up with that information campaign, keeping up with mobile vaccination units, eliminating any barriers to vaccination that can be identified in the community. These are all efforts that need to be done. Of course, there is a priority, but they have to be done in parallel, all at the same time.
At the same time. Speak of that, Zhiwei, of course, we'll come back to the resource management bit. But before that, in terms of this vaccination, in particular for the senior group of people, and I would say, let's say for those who are over 80 years old, this group of people, if you look at the number in China, the percentage with a booster, for example, is only 42% until December, the middle of December. So if you compare that percentage with countries like South Korea, Japan, or the United States, or European countries, that's rather low. What are the reasons, somehow blocking people, preventing people from taking or accepting or voluntarily to take the vaccination? Professor Wu.
Sorry. I think there are a number of reasons. One is that when China started its vaccination program, so basically the focus was on the working age population. So that actually the whole public campaign and the vaccination push were very much basically targeting in this population. So that's why if you look at the over the year, over the months, the vaccination population, basically in the working age, it was going pretty well, so very smoothly. And in the elderly age, particularly people over 65 years old or even 80 years old, actually, there wasn't much effort put into that area. So that actually, I think it was a huge mistake because one of the reasons was that I think, from the epidemiological point of view, initially there was some misunderstanding. People thought, okay, the virus is not going to stay here for a long time. Once you place a very strict public health prevention containment measures, the virus will eventually die. So that's why the vaccination was not focused in the elderly population. They think that, okay, once we control the virus, then this particular population will not be a big problem. But that actually, to our surprise, the virus is so persistent, it does not go away. Now we realize that we probably have to live with the virus. So just when I listen to the report back from Sichuan, many of the elderly population people were basically receiving their first shot. It's actually, unfortunately, it was too late for them to take the first brand of this new wave of infection. But hopefully that once the vaccination push on, they will build up their immunity against the future infections. So it's the same situation in Nanjing and the Jiangsu province. In the elderly population, actually, many of them have not had their first shot. So this is something actually we need to put particular attention on it. Fortunately, if you look at the national data, the vaccination rates actually is picking up. And I guess that the reason picking up is basically because the elderly people are receiving the vaccine.
Well, Dr. Alice Tan, back to the resource management, China is, of course, like readjusting its policy in terms of the responding to the epidemic here. For example, I think it's Tuesday, China has been, there's a press briefing, health officials were talking about enabling the grassroots level health institutions. For example, the community-based clinic or the rural clinic to enable them with, I would say, equipment necessary in terms of treating patients. At the same time, the focus will be on the vulnerable group, those aged 65 and above, health kit, including a variety of medicines such as a fever, fever and also cough reducer and antigen test kits will be granted, will be accessible for those vulnerable group. What do you make of this move and these kind of efforts?
These are all very good efforts, and I'm sure that they will be helpful. I think when the concern is about what is going to happen in the rural communities in the countryside, one technique or technology that can help is telemedicine. And you talked about grassroots community level hospitals. So not every region is going to have a specialized infectious disease department or an ICU with many ICU trained doctors. But if you can have a 24/7 rotating basis of an ICU doctor on call who can help with telemedicine to a regional physician and coach them in how to take care of COVID patients, that can be very helpful because not everyone is going to be able to have one-on-one care with an infectious disease specialist. So using telemedicine is going to be very important. Having 24/7 information hotlines available to people will also be important. I think communication is one of the greatest tools that we can use against the fight against COVID. So if a person has access to a 24/7 hotline and they're diagnosed with COVID, instead of rushing to an emergency room, they can call the hotline. The hotline can be manned by many people in a call center, and they can get the advice that they need. So many people, as was mentioned before, are nervous. They're anxious when they have symptoms, when they're diagnosed. But 99% of people who get COVID will recover. We just want to make sure that we save as many lives as possible, and we make the process of being ill comfortable as possible. And communication will be very important. And so I think making use of tools of communication will be helpful in the fight against COVID in China.
Professor Wu, I mean, communication is important, as Dr. Tan mentioned. You also mentioned at the very beginning, for some people, when they get infected, they became nervous or even panic, and they want to go to the hospital. And then you just find that there's, let's say, there's a lack of resource because the hospital probably are better equipped to deal with those serious cases instead of, for example, young people get infected. So communication and the information being available, say 24/7, is important here.
It is. Dr. Tan raised a very important issue here. Actually, this is exactly what we missed in the very beginning of this opening up. What you can see is that, once we're opening up, a lot of people are very confused, and many of them actually went on the internet, and I even got a lot of calls, and some of the questions actually could be simply accomplished by communities, but government pamphlet, basically you could distribute some basic knowledge when you need to do if you feel fever, if you are infected, and you don't have to flock into a hospital and crowded in line for several hours to get checked, and basically you have to be sent back into home. So this is something I think it's so critical that the government, the community could basically coordinate doing and distributing information and give certain guidelines what you need to do if you are infected, whether you need to stock, what kind of basic medicine and devices you need to prepare. If your home have elderly people, have people with some underlying medical conditions, what you need to do and what actually particular attention you need to pay to. So those are the things actually can be well done by either telecommunication or 24-hour hotline or even pamphlet, because China has a tremendously powerful social network which actually government can utilize to penetrate every household. So this is something I think we should fully utilize to deliver helpful information.
Dr. Alice Tan, many people are also concerned about the so-called, quote, unquote, long COVID, which is still experiencing some COVID symptoms even after recovering. So what do you make of that? Is that long COVID, or, is it simply lingering symptoms like a cough is not that serious, or is it something people need to pay attention to or need to see a doctor?
Well, I'm glad you asked this question. It's a very important topic. And because COVID is a brand new disease, we're still learning so much about COVID and long COVID. First of all, I'd like to emphasize that long COVID is real. It's a real condition, and it can be very subtle. And just like COVID, acute COVID, long COVID can have many different manifestations. And they can be very subtle, as I said, and some can be very serious. So in terms of the duration and when we make a diagnosis, usually after an acute episode of COVID, if a person still has symptoms after 3 weeks or 1 month, then we can consider that there might be long COVID. There are a number of conditions that having had COVID increases your risk of developing. So for example, there seems to be an increased risk of blood clots in the lungs, but also blood clots in the brain that would cause a stroke. There seems to be an increased risk of autoimmune conditions happening. People many times complain about fatigue, brain fog as well. And, some of these symptoms are very difficult to assess, even from the patient's point of view. They're very subtle, so they may not realize that they have COVID, long COVID. So in this regard, I think dissemination of information is very important so that people don't suffer from these symptoms for a long time, not knowing, why am I feeling so tired, or why am I feeling so out of breath, that they can consider, oh, maybe this is long COVID, and then they could get checked out. There is still no biomarker for long COVID, which makes it difficult to diagnose. And of course, because this is a brand new disease, there's no expert really on long COVID. There are some centers of excellence around the world, but it's hard to find an expert who knows. Fortunately, there are resources online that can be accessed by both patients and medical professionals to help patients with long COVID. But I would like to emphasize that long COVID is real. It can be very serious. There are ways to deal with it. And the number one thing is to recognize when you have symptoms, to get evaluated, and to understand that sometimes pacing your energy throughout the day and throughout the week is a very important way of dealing with long COVID. Don't try to work your way through it, or think that, if I'm just tough and strong enough, I'm going to recover from long COVID. That's actually the wrong approach. You should be very mindful of your symptoms. It can affect your sleep, your mood, and every organ system of your body. And if you suspect it, seek medical attention.
Can we say also having good rest is also very important after even you recovered?
Yes. So rest is very important. Don't try to push yourself through your symptoms. If you feel fatigued, give your body enough time to rest and recuperate. That's one of the best things that you can do to try to recover from long COVID.
Well, thank you, Alice Tan, and also Professor Wu. On that note, we concluded today's show. Many thanks again to our guests, and Dr. Alice Tan and Professor Wu. You can also find us on the CGTN app on YouTube. I'm Xu Qinduo. Thanks for being with us. See you next time.